Recording. Mm-hmm. I have the chat up and somebody is, she's going to be sitting here to do that.
Oh, okay.
Okay. I'm just letting you know you already have a question on chat.
Okay. Okay.
Yeah. Verbally just tell everybody. I'll tell them the assistant.
Hi, everyone. We have a few questions that we would like to address right now. One of the questions is whether the slides will be available. Yes, they will be available on our website. And the second one is whether we are recording and whether the recording will be available on our website. Absolutely, we always do that. So it will be available to you all. And before we start, I'm just going to give you some quick background information. And one is that, can you all see the screen? Can you all hear me?
We can see your screen.
You can see the screen. Thank you so much. I needed to hear some voices. I feel like I'm just talking to myself. Thank you all for attending the 2019 Motor RFA pre-application training session. You're all welcome. Thank you so much. So with our motor application, we want to thank you for your interest in the application. That's one. And of course, you can see on the screen that the training session will be recorded and it will be uploaded to our motor and MHHD website. And we also we're advised by our Maryland Department of Health IT staff that the webinar works best in Chrome. And actually, last year we did have a lot of issues, you know, when some people try to use just Internet Explorer. So Chrome will work well, but some people, I think it works also in Internet Explorer, so you can try that. But if you're unable to get in onto Chrome, you try the Internet Explorer. Or you can call the toll-free number and listen in. So some people are already online. Thank you so much. So just before we move forward, I want you all to know that the MOTOR, which is our Minority Outreach and Technical Assistance Program, here with the Minority Health and Health Disparities Office, within the Department of Health, Maryland Department of Health, that we have a staff. We have our director, who is Dr. Noah Brathwaite. He started with us a few months ago. We also have our epidemiologist. We also have our epidemiologist, Dr. David Mann, and we have our procurement supervisor, Diane Walker. We also have our program administrative specialist, Dr. Olubukola Alungi. And then, of course, you have me, Namisa Kramer, and I am the MOTOR program administrator. And I am sure a few of you have been calling a lot, and some of you have been sending me emails, and hopefully I've been responding to your inquiries as best as possible.
We have to adjust. They're not able to see the slides.
Okay, can you please just hang on a second? Some people cannot see the slides at all, so just give us a few minutes. We're having some technical glitches here.
What they're seeing is all of this. They're not seeing that. So Erica, they're seeing all of this. They're not just seeing the main slide.
Okay, and we also have Stephanie Slowly, who is our deputy director. She's been here now with us for over a year. So what we are going to do today, we are not going to go through the whole RFA, like every sentence, going through every sentence, because I'm sure a lot of you can read. So we are not going to read everything to you. What we have done is actually extracted some really key information from the 2019 RFA, because MODA has really taken a different direction. And now it's a results-based program. We need outcomes, because our funders and the government are after us that, you know what, if we are developing programs and implementing them, we want to see results. We want to make sure that you're impacting, you know, the community that you're serving, and the jurisdictions where the programs are being implemented, that the data is showing that, you know, the MODA program is actually contributing to the good outcomes and actually impacting health indicators in those jurisdictions. So we just took out just a few really key issues that we are going to discuss so that you all can really understand and grasp, you know, the key issues that you need to know about the RFA. So just a quick background, that MODA was implemented in 2001, and it was born out of the Cigarette Restitution Fund program. So a lot of you probably know about that, where some states like sued these cigarette companies and actually won a settlement. And out of those settlements, you know, they developed programs where actually they were concentrating on tobacco and cancer. And so what they did was they decided to develop the Minority Outreach and Technical Assistance Program so they can fund grassroots organizations, so they can recruit minorities to sit on the coalitions of the tobacco and cancer prevention programs, so that they can also have a say, you know, in their health and probably in health issues that were affecting the minority communities in these jurisdictions, so they can have some sort of say in all of the decisions that were taking place at these coalition meetings, you know, with reference to their health. And so they were conducting outreach and technical assistance to the minority communities. And they were also promoting participation in the tobacco and cancer coalitions. And so what happened actually, we had another director who came on board and decided that we needed to expand, you know, not just going out there and talking about tobacco and cancer, but also there were other health issues that were affecting minorities in different jurisdictions. So those were like diabetes, pregnancy and birth outcomes, cardiovascular disease, and of course asthma. So we are now going into the RFA, and I just want to talk about the eligibility information just a little bit. And you can find that on page 6 in the RFA. Hopefully you can see it if you have it in front of you. So we are funding based on the population in the different jurisdictions. There are some jurisdictions that have like 20,000 less population, and that if you are in that jurisdiction, you can apply for up to $25,000. So before I go on, I'm sure some of you are probably thinking you have questions, but the chat is on. Please send in your questions and then hold on to your thoughts. At the end of all the presentations, we will then go over, during the question and answer session, we'll then actually, read out the questions and then respond accordingly. So if you are in a jurisdiction where the population is 20,000 or more, and then you can actually apply for $50,000, up to $50,000. And then you have to have a letter of commitment. The letter of commitment can come from your local health department, and then your IRS form. But you have to be in good standing with the state of Maryland. And also, some people have asked me this question, can they apply in another jurisdiction and actually implement the program in another jurisdiction? No, you cannot. You can only apply for funding to implement the program in the jurisdiction where your program is located and where, your target population resides. So that is clear. You cannot really apply. Let's say you live in Prince George's County, you cannot apply, to implement a program in Montgomery County. But if you do have your organization, a satellite office in Montgomery County, they would have to apply separately for the MOTA program. So your award information can also be found on page 7. And of course, if you're awarded, you'll be given an opportunity, this is actually key, to apply for a grant renewal for FY 2020. So this is also key. Here are 6 focal areas for FY 2019. And this is where we were also saying that MOTA is now taking a different direction. We are no longer asking organizations to apply and actually implement programs for 2 focal areas. You no longer have to actually do that. What you need to do is, out of these 6 focal areas for 2019, you have to look at pregnancy and birth outcomes. You have to look at cardiovascular disease, diabetes, obesity, cancer, and asthma. And make sure you do a needs assessment. By the way, in the RFA, we also provided links to data. So you can do in your jurisdiction, you can actually conduct a needs assessment and do a research for data on all of these focus areas, disease focus areas, and then see where there is the most need in your county or in your community, and then actually develop your program around that. So just choose one. Don't choose 2, because if you choose one, it will actually give you that leverage to actually develop a robust and very cohesive program, which is what we want to see, because then it will give all of us, the state of Maryland, including you, your organization, a really credible data and good outcome. So that is what we are emphasizing this year. So the expected focus, that you should, if you develop your program, you should have these characteristics. Linkage to health insurance enrollment. If you are concentrating on, let's say somebody is diabetic, but they don't have insurance and they don't know how to go about, getting treatment for their diabetes, They don't know how to manage their diabetes because they are afraid to go to the hospital because they don't have insurance. So you should make sure that you link them to health insurance. Linkage to primary and preventive care and social services, whatever the needs are of the client that you'll be targeting. Assistance and coordination and navigation of primary and preventive health care services. These are all services that some people in your program may need. So you need to make sure that you're actually doing this. Self-management support through home visiting programs, using community health workers, visiting nurses and social workers. And we've just added this there too. So bear with me, this is going to be like a mouthful, but I will make sure that I go over it slowly. So among your enrolled participants in like a cohort or longitudinal program, you have to have improvement in focus areas, specific health indicators such as BMI, blood pressure, blood glucose or A1C, physical activity, fruit and vegetable consumption, and of course, you all know where I'm going with this. There's a diabetic, patient or, someone that is actually enrolled in the DPP program. Sodium, salt consumption, respiratory peak flow readings, cancer screenings, maternal smoking and substance use, and now we are talking about pregnancy and birth outcomes. So we are giving you some of the outcomes that you should actually be concentrating on. We also have prenatal care, full-term delivery and normal birth weight, and emergency department visits and hospitalization. So if I'm developing a program, let's say for somebody who has asthma, for a child that has asthma, I'm going to be asking that client, like how many times have you been going to the ER? That means something is wrong. If you're constantly going to the ER, something is missing right there. So you have to make sure that that is down, and also your intervention. What are you going to do to actually make sure that, this client whose son or daughter has asthma is not constantly going into the ER, visiting the ER, because we all know that can be very expensive, and hospitalization. These improvements would be demonstrated by measuring before, during, and after your intervention values of these indicators in participants who will have ongoing contact with the program. So here's your application information, which you can find on page 8. And I'm going to talk about the format of the application. It should be no more than 10 pages long. And we have to do this because you really have to think about your program. Make it really succinct. Make it strong, make it a robust program, but also don't go on and on and on. I mean, now you're only concentrating on one disease focus area. So you shouldn't be writing more than 10 pages. It should be a 12-point font, Times New Roman, 1 each margin, and it should be double-spaced. And each page should be numbered sequentially. So for your cover letter, by the way, we also have all of these, sample of these on the website, and there are links in the RFA to take you to these. Please, please, please make sure that when you get to those attachments, you click on them and really make sure you know what they are, because you're going to need them for your application, for your proposal. So you see the sample letter and signature of authorizing officials. Please use blue ink. Your federal tax identification number. Here I have to give you a hint. You have to make sure that your federal identification number is in place and that you're in good standing with the state, because when your application comes, I'm going to use your federal tax identification number to actually write to the Comptroller of Maryland to tell us if you're still in good standing with the state of Maryland to conduct business here. So please make sure you're in good standing. Tell us about your organizational capacity. You'll find this on page 8. Actually, it's over there. It's actually in depth. State current or previous experience working with target populations, your ability and experience in promoting health education, your organization's background, structure, the mission and performance, how well you've been doing in your community. Please include your organizational chart, and of course, there will be an example. Bookie, can you click on that, please? Thank you very much, so they can see it. Just give us a few seconds, it's opening up. Can you all see it? We just wanted to show you an example of an organizational chart. And we had created this link so we could open it up for you to see. Can you all see it?
No, right now your pointer is not on the organizational chart example.
Thank you. Give us a minute and we'll be right with you.
It's opening up on our laptop. We can see it, but it's not opening up on the screen. So let me continue. Your executive summary, page 8, you have to state why your program is important and why we should fund you. Pretty much you have to sell, your organization's, like we said, capacity and ability to implement the program that you are going to be proposing. And then the population you are going to be serving in your jurisdiction. And then with your executive summary, limit it to 2 to 3 pages. Max, if I were you, I would just limit it to 2 pages. I won't go on and on and on. And then for your narrative, you have to concentrate. This is where you concentrate on your problem statement. That's on page 9. You describe the nature and scope of the problem, describe the need for a local motor program in your jurisdiction, and you are also provided with links for health disparities data on page 9, as I have stated before, as soon as I started this presentation. In the RFA, you have resources in the RFA. There are lots of links. We provided that in the RFA. So please make sure you use those. Okay, what I am going to do now, I'm going to hand you over to our epidemiologist, Dr. David Mann, who is going to present now on the need for accountability, and there are other great information that he's going to actually provide you here. So please listen in. Thank you very much.
I'm going to be talking about the key element of your proposal, which is how you design the program, the work plan, and the evaluation plan. And to preface that, the reason we're getting so detailed about how the plans need to look and how the data collection has to look is that we have this acute need for accountability. We're getting asked all the time, how much bang for the buck is the state getting for the money that it's spending? So imagine that you were in a position where someone asked you, coming from the state the Legislative Affairs Office doing an audit, what did Maryland get for the money spent on your program? How would you answer that question? How would you be able to prove your value? We're trying to provide you with the tools that can allow you to give a nice, clear answer and prove that the money was spent well. Now, this was an interesting book title I found once, Trying Hard is Not Good Enough. It's kind of where we're at, and it's also at the top I've got another quote I've heard that I like, which is, don't confuse activity with accomplishment. So it's not just enough to be busy. You have to be able to demonstrate how much value the busyness produces, and that's where we're trying to go. So we're going to be talking about goals and objectives. Ultimately, you're going to be making a problem statement. You ought to be able to express your problem statement as the baseline values of the SMART objectives that you're telling us you're going to improve with the program. So once you identify the problem, the goal and objective is to make a measurable change in that problem that you've identified. And of those 6 focus areas, you're going to be selecting 1 to work on. And you may notice, for example, this year, tobacco wasn't one of the 6, and health insurance wasn't one of the 6 as they were a couple years ago. You might still be doing things around tobacco, and you might be doing things around health insurance, but that would be part of getting to an outcome that might be reflecting asthma ED visit rates, where getting people, health insurance might be part of your plan for that, or improving birth outcomes, where reducing tobacco use in pregnant women that you're working with might be part of how you do that. So I think some of the other things we've done in MODA may still be part of the program, but they're not necessarily the ultimate outcome objectives that we're focusing on for this cycle. So the goal is a broad statement of the health area you expect to improve. SMART objectives, you want to be able to identify a particular measurement you can make, that you can understand what it is before you start in the people that you're working with, and what you expect it might be by the time you're done with the people that you're working with, and hopefully be able to demonstrate that improvement. So mostly you're going to be doing these objectives around the people that you're touching. And again, as we've said earlier, this year we're really focusing on programs that touch people multiple times, not just, well, we touched you once and you go off and we hope something gets better, but we touch you multiple times and we know for sure because we're measuring that something's getting better. So we're going to be talking about measures or metrics. Basically, anything you can express in a numerical fashion, like an infant mortality rate or a prevalence rate of diabetes, a percent of the population in poverty, a rate of emergency department visits. That is a metric. It's a measurable concept. The value of a metric is a particular measurement you can make on it at a particular point in time. So with Black infant mortality, there was a rate in 2011 of 12. In 2014, there was a rate of 10.6. It's deaths per 1,000 live births. And the metric, in a sense, generally is infant mortality rate. The specific values are the 12 in 2011 and the 10.6. So you're going to have a baseline value for the metric that expresses your goal, and you're going to have some follow-up values. And in a sense, the follow-up values define some performance measures on your ultimate objective for the program. So we want objectives to be SMART, and SMART stands for specific, measurable, attainable, or achievable, relevant, and time-bound. So we want it to be specific, so it's really not just a vague notion, but it's really something we can get our hands on, so that's why we want it to be focused around a metric. If we have a metric, it's kind of automatically measurable, and it needs to be something attainable, so if we know what it is when we start, we have to have as our goal something that's reasonable to achieve in the 1-year time frame that we're writing these proposals to, and it needs to be relevant. The values that we're going to try to achieve will help make a progress overall in reducing health disparities. And time-bound, we want to be able to say we're going to do this in a certain amount of time. And again, the program has a 1-year time frame that you're writing the application to. It is renewable for a second year, but we want the application to be written for that initial 1-year period of time. So as part of describing this, you're going to develop a work plan. The work plan is designed to answer these questions. How much of what is going to be done by whom? When will it be done, and how are we going to measure how we do it and what results we get? So what are the activities and tasks that we're going to deploy? How many activity items are we going to do? So if we're having some kind of sessions and people are coming multiple times, how many sessions are we going to have? How many people are going to be attending? How many instances of attendance do we have? Because if 10 people come 10 times, that's 100 instances of attendance. And in a lot of ways, your budget is a function of how many instances of attendance happen. A program where you touch a lot of people is going to have fewer total people for the same budget. So by whom, which of your staff are going to be carrying out which of these activities? We want a clear picture of that. what kind of schedule do you have for the activities, how often, how frequently, and what are we going to be measuring? We want to measure how many of the activities, how many people we reached, and how many instances of reach. We want to have a way to measure what the impact is on the people that we reached as a result of having performed these activities. So you're going to be also writing up a logic model for the program. That's going to basically discuss what are the resources you're going to be able to deploy. Those are the inputs, and then the outputs. You're going to tell us what kind of productivity are we getting. So again, what kind of activities and what kind of reach are we going to be getting out of that. And then the last part of the logic model on the next slide is our outcomes. And so we're going to have short-term, medium-term, and long-term outcomes. I think for programs like we're talking about for 1 year in MODA, the short-term things we get are people improve their knowledge, attitudes, and beliefs. So if we're trying to work with people around diabetes, we're trying to get them to understand physical activity, better nutrition. In the medium term, we want them to take that knowledge and turn it into a behavior change. So we want to follow up with the people and see if they're actually changing their behavior. And then in the longer term, but still within our 1 year time frame, if they're changing the behavior, is that resulting in some weight reduction, a change in BMI? If they're going to their doctor and getting their glucose checked, is that glucose getting better? And so we can actually see the real health benefit that we've had in the people as a result of changing their behavior, which came from changing their knowledge, attitudes, and beliefs. So we can measure impact at the level of the people we touch or possibly at the level of an entire community or jurisdiction, but that's much harder and may not be feasible for most of the programs. We expect that we're going to get follow-up information about medium and long-term outcomes on the people that at least we're reaching, and that's why we want to have these program designs that have repeated contacts with the same participants over an extended period of time, because that gives you a chance to be able to collect the information about whether they're improving those health outcomes. And so sometimes it's helpful to actually take a program that's been evidence-based and published out there in the literature and just kind of design your program based on the model of these other programs. So there's a page in the package that has links, a link to a page on our website that has a lot of other links in there about different evidence-based programs for each of the focus areas that you might look at it as a potential model for the kind of program you might want to design. So the work plan elements, there's a narrative description of the work plan that's going to be in your 10-page piece. You actually don't have to put every single detail into that part of the narrative because the whole thing only has 10 pages to work. You can put a lot of the detail in the work plan template, into the logic model, and a lot of the schedule information will be in the Gantt chart, and there are attachments in the RFA package as well as on the website, a downloadable form that you can actually enter your information into for each of those items. And the other thing you want to make sure you mention in the work plan is in the RFA on page 12, there are activities listed, items A through D, where we're expecting you to do at least one, if not more, of those kinds of activities. And then there's some very generic MODA activities that are on pages 12 to 13, items E through L, where we expect the grantees to be involved in all of those activities. So that should all be reflected in the work plan. Outcomes are the measurable benefits of your program in terms of not only did we touch people, but people are better off as a result of having been touched. The SMART objectives that you have that are really the foundation of your program ought to be these health status improvement outcomes and objectives. And you can also have outcomes that are intermediate steps on the way to your ultimate outcome. So potentially if insurance enrollment is one of the tools you use to reduce asthma ED visit rates, then you might build an objective around insurance enrollment. That may be a little harder to know at the time you're writing the application because you may not know for sure how many of the people you touch are going to have that need. So that may be something that becomes part of what you track, but it may not be something you're going to know at the time of writing the application. You need to define outcomes for the people that you reach, so you're collecting that follow-up data. It's optional as to whether you're going to try to define outcomes for, say, the whole community, including the people you don't reach. That's often very difficult to demonstrate, and it's often very difficult to even collect that kind of data at the small community level. So it is okay if you're just doing it with the people that you're touching. Target population, are you trying to work in the entire city or county? Are you working in a little small subset? Let us know about that. Are you focusing on a particular racial ethnic group or on lots of different groups? Is there a particular language group that you're focusing on? Or if not, what's the language distribution of the folks that you're going to be targeting, and then what kind of language interpretation and translation might you need? Is there any poverty, educational status, employment status information on your target population that you can provide? How many people do you expect to serve with your in your proposal? And of course, when you put that number down, it should also make sense with what you've written in the work plan in terms of how much activity and how frequently people are going to have to be involved with it. And your program must be primarily designed to reach racial and ethnic minority communities. And in terms of partnerships, you want to provide a list of the partners you expect to have, and we require you to be having a partnership with your local health department. Describe the role of each partner, in particular what's the role of your local health department going to be in your project. And we need letters of commitment from each of the partners, not just something that says we think this is a good idea, but something that says we're a partner, we have a certain job to do, and we are committed to doing our job. And again, that's mandatory from your local health department, and we really want it to be a sense of them actually having a specific task and a responsibility. From a management point of view, describe the staff you have and the consultants you might be working with. We're no longer allowing folks to basically subcontract funds out to another vendor who's then going to have multiple staff there. It's still okay to have one-on-one relationships with consultants, but to basically farm out a big chunk of the work to another massive subcontract is really not what we're looking to do with the funds. Clearly define any staff and consultant roles and deliverables, provide us with resumes or bio sketches that define their educational background and experience. Make sure there's a clearly identified program manager, clear reporting lines for staff and any consultants, and a clear specification of who's being supported by how much of the funds, and specify who's responsible for financial management, fiscal and productivity form submission, and interface with the project team here at our office. And finally, for evaluation, how are we going to demonstrate that we've been successful so we can satisfy those auditors and make them happy that they've gotten value for the dollar? So you want to describe the method you're going to use to evaluate success, describe whatever tools or methods you're going to use to measure outcomes. You might be planning to use pre- and post-tests. You might be using surveys, or if you're going to measure indicators like BMI, blood pressure, glucose, peak flows that you might use in asthma, what methods you're going to use to collect that information. We need to see that. Describe the data you're going to collect and how you're going to collect it, and you want to be discussing how your program's operating at 3 levels. So capacity development, we said we were going to build a structure to implement this. How successfully did we build and put in place all the pieces we needed, and did we get that done on schedule? Productivity and effort, so we're supposed to have X number of sessions reaching Y number of people. Did we in fact get all those X sessions done, and how close to reaching Y people? Did we even reach more than Y people? Did we get into the program? And then finally, of those Y people that we reached, what benefit did we have? Did they have fewer visits to the emergency room? Did they end up improving their BMI or their blood pressure or their glucose or things of that sort?
So with dissemination, which is on page 15, you have to describe how you plan to inform the public, policymakers, and other key stakeholders about your project. How are you going to sell this project? How are you going to, let's say, recruit for your project? But really, not just at the end, but throughout the project. What are you going to do? How are you going to let people in your community know that you are there and you are a MOTA grantee and you are actually going to be implementing a MOTA program around cancer, around cardiovascular disease, asthma, or pregnancy outcomes. You have to disseminate the milestone achievements. You know, you have to actually make sure that you document that. Your operational capacity is in place, like a grand opening, and you can invite us. You know, if you're awarded, you can invite us, you can talk about that. But periodic reports on persons served, end of project improvement in outcomes. So you'd have to talk about that. So I will pass the baton now to Dr. Olubukola Alongi, and she will actually take you all through the key documents that you are going to be working with for your programs that we would want to see in the proposals.
Thank you. So good afternoon again, everyone. So I'll be starting from the document that you have showing at the moment, and it is the work plan. So it's already been talked about in details, and we'll just take you through a few things. So from the template, and this is the same template that you have online. Is everyone able to see this document? You could send a message in the chat, and that would be great. So this is the work plan, and just as it is, and we've just put in some information just to show an example. And as already been stated in the RFA, we do not want this same template regurgitated and submitted with the application, but this is just to serve as an example. So the disease focus area for this particular template is obesity, and you see that for this particular individual, they've just entered one of the 6 disease focus areas as has already been previously outlined. The next thing on the template talks about the overarching goal, and it says here that it's to reduce the rate of obesity among children enrolled in the XXX program. XXX happens to be the name of this particular program we're talking about. And like it was said before, goals are not SMART. So it just talks about what exactly do you want to do. You've done your needs assessment and you found out that obesity is a big thing among kids in your county or your jurisdiction, and you want to work with that. You want to work with that. So then the overarching goal will be that you just want to reduce the rates of obesity among children enrolled in that particular program. Next thing that is requested is the objective. And on this template, you would see that we have put a couple of objectives on the template that we shared with you. You could add rows to that template as needed. So we put on the template just 3 objectives because we're not thinking any goal would need more than that. The fewer the objectives, the easier it is for you to manage your program. We have also said on the template that if you would have another goal for the same disease focus area, you should use a different template. So one goal alone should be on a template for one disease focus area. So the objective is SMART, as has already been discussed. And if you can see from here, it talks about increasing the proportion of kids in the XXX program. It is specific. Cohorts who consume 2 servings of fruits and 3 servings of vegetables by 50%. So you're increasing the proportion of those children by 50% by May 30, 2019. And if you see this objective, you see that it is specific. You can measure it. You're measuring in terms of how many servings based on the recommendations of fruits and vegetables. It is, so it is specific, it is measurable, it is attainable. You're giving yourself enough time to do this. You're giving yourself the 1-year period, that by the end of the 1-year period or thereabout, it's a few months short of 1 year. But by that period, you would have accomplished this. So it is attainable, it is realistic, the objective always has to be realistic. Do not put an objective that is going to be difficult for you to accomplish. Make it as realistic as possible, and it is time sensitive, which is the reason why we have said from the time that I start this program in this example, by May 30, 2019, I would have completed this objective. So it has all those characteristics that are found in the SMART objective. And if you would go on, we put in explanations of what we expect under activities, under the timeline, each of those columns, under the expected outcome, data source and methodology, which staff will be responsible, budget allocation, and if you have any comments. So we've just put an example for one objective on this template. So, okay, so you could go through this at a later time and okay, I'll just run through this, and I'm sure you could whenever, audio went out. Can you hear us now? Oh, now you can, thank you. So we just run through this, and you could always go back to this at a later time. So the first activity for that first objective was that you were going to recruit kids into that particular program with a name, and then you put your period. What we've seen in the past is at times people would lump in months and put the entire from July to June 2019. Yes, we know that is the entire period for the one-year program, but you have to be able to break down into timelines each activity. So if you would look in this example, you will see that you'll be recruiting kids into the program between July and August. So you're giving yourself a 2-month period for recruitment, a 3-month period for doing the program, which would be the next activity, and then another a 3-month period, and then another 2 months, because from what you would have said in this program, you are going to be having 2 cohorts. So between July and August, you would recruit for the first cohort. September, October, November, you would conduct the program and evaluate, and your evaluation for this will be either you're tracking the weight or you're doing an assessment of if they've shown an increase in intake of vegetables and fruits and things of that sort. And then your next cohort will be between December, recruitment will be between December and January, and then the next 3 months will be the intervention period when the program is implemented. So if you would go through this at a later time, it's all self-explanatory. So, what did I do? Okay, and we're right here with you. Okay, so so the next template, so you would see that we've already talked before. Previous presenters have talked about the fact that you would need to submit the work plan, the Gantt chart, and the logic. So the Gantt chart for the particular work plan that we just talked about is what will be showing on your screen shortly. So, okay. Are you able to see this? I'm not sure.
Can you all see?
Yes. Okay. Thank you for responding.
Okay. Thank you.
So this would be an example of the expectation for you to complete your Gantt chart, and this is a template that is already saved on the website. So there is a section that asks for the name of the program. You would put that there. You would put the name of your jurisdiction and whatever is the requirement there, and whoever will be the program manager, you would complete as well. So the top section of that document, as is shown on the website, asks about the goal, and that will be the same goal exactly as it applies in your work plan. It talks about the activities that are touching all objectives, and these were just copied from your from the application. If you would go into it, those include activities such as you participating in your cancer coalition, such as you collaborating with other MOTA grantees and other community-based organizations, attending your quarterly MOTA grantee meetings, as well as other requirements that cut across no matter what month you're working in. You would do that, and that doesn't really need any specific timeline. There is a coalition meeting, you attend in your county. And those will be all the things outlined from Activity 1 all the way to where it says the quarterly narrative report. Those will be required of every grantee that is awarded throughout the course of the fiscal year. So when you go into the second section, where you start from the objectives, this is where you would document all the objectives as written on your work plan. So the objective would be whatever you put on your work plan as objective 1. Activity 1 would be whatever activities you have on your work plan as well. So these documents flow into each other. You know what program you want to do, and they are aligned with each other. When we see it, it's exactly the same thing being said in all these documents. So for example, and if you would go to the lower part of the document, you would find a color code that talks about if it's a program planning phase, you use this color. If it's the program implementation phase, you use the dark green. If it's a program evaluation phase, you use the light yellow. And then if you go up to the first objective that you had, you would see that for July and August, ideally, that is when, for the first quarter, that is when you're recruiting. So the planning period would have occurred at some point before the recruitment. So that's why you have those two colors there, showing either the planning or the implementation, because at this phase you're implementing recruitment. And then the yellow talks about the evaluation, and then it goes on and on for the different cohorts. The next activity is where it talks about the biweekly nutrition classes for 3 months. And you see that that shows that you're implementing the program for those 3 months when you're actually implementing as stated in your work plan. And that will be from September through November. So that will be September, October, November of 2018. And then by December of that month, you're evaluating to find out if, okay, you decided to recruit and to train or to educate 40 children. Did you accomplish that? That is where you do the evaluation, and that's why it's yellow here. And it's important to know that some of this, for some of your activities, implementation and evaluation will be happening concurrently. That is a possibility. Because, for example, you're implementing the program and you're tracking weight, which is some form of evaluation, at the same time if you're tracking weight monthly during the time when you're still doing the program. So at times they could happen concurrently. And that would be that. And so that would be all for that particular document. So next will be the logic model template. And this also aligns with your action plan as well as it aligns with action plan as well as the Gantt chart. And I do not know why this is not showing. Did you click on it? I did. It's showing on my screen. If you'd give us a minute. Okay. Yeah. So the logic model, the example that we have put up, you would be able to view on the website at a later time. Mm-hmm. So, okay. Just give us a few minutes and we'll be right with you. So what is that?
So what we are going to do is we can't really open up the logic model template on the screen, so you would actually be able to access it on our website. So see the example in there. Our laptop just got stuck. We are getting some. Yeah, okay, there it is. You all can see it? Yay.
So this wasn't the example we had. This was just another example, but you could view all the documents at a later time with an example. And this link just shows what you already have on the website and the fact that it's important to model your programs in line with the best practices, and definitions are on the website. Thank you very much. Okay, thanks.
Thank you, Buki. So we now have Diane Walker, and this is very important because Ms. Diane Walker is going to talk to you about budget and supporting documentation that you are going to need to actually make sure that you include them in your proposal. So here is Ms. Diane Walker. She's our procurement supervisor here.
Good afternoon, everybody. Thanks again for joining us for this fantastic day for the MOTA 2019 RFA. I'm very excited to be able to get here to do this with you guys. Anyway, the documents that are needed for the to support for the MOTA RFA, you will need to complete your budget forms. And your budget forms is the entire series, budget form A through H 432. And with those forms, the first one, it primarily gets you to identify exactly who you are as an organization, providing your name, your organization address, the contact person, and et cetera. Now, basically, on the first page of the 432A, and these forms are also on the website, you will only need to print the information provide the information that's requested. And what I've done this time is I've highlighted certain fields that you would need to complete, and the first field will be the signature on the first page of the 432A, and provide us with the type, with your name type right below that, and provide us with the date and the title. Now, the program budget is the primary form that will drive this particular package, because we need to make sure with the program budget, the 432B, that you complete it correctly, because with this budget, you will be identifying exactly how much you will be spending for what you are going to be held responsible for the entire year. And with this, the form, I've again highlighted the areas with yellow to ask you to comply and provide the requested information. Your program administration title, if you are a prior grant with the motor office, you will know your grant number, so you can record that number in there. But if you're new to the program, you can leave that area blank. The contract period will be from July 1, 2018 to June 2019, and that's the contract period. You will also need your organization name, your street address, city, state, and zip. And beginning with the first column that has MDH funding request, that particular column is where you'll be entering all of your numbers that you are going to allocate for each of the line items. You cannot change any of the line items on this form. What the line item called salaries and payments, that's exactly what you would have to record it for. We cannot allow you to make any changes to these line items because it's what we are held accountable for when we produce the forms at the end of the year to balance up to the budget that we have to support. The form, the blue column, the program budget, contains a formula so that it will allow you, once you put in your funding request, the same figure that you put in that column will also populate the field called the program budget. Therefore, you will not have to put that number in there. And organizations that have indirect costs, you can calculate that at a percentage of your total budget. And this year, we've all indicated that we look for administrative costs to be no more than 7%, because we would like to make sure that most of the dollars in which you apply for that is used for the program. Oh, okay. Okay. I'm checking with the team to find out if there's a question. So with that being said, identifying exactly how you're going to be spending the money per each line item. The next form, the 432C, is where you're going to be identifying your performance measures. Again, you'll be required to put in your program administration, the fiscal year, your organization, your address, and your program title. And under the column, this is budget year, the estimate, that's where you're going to be indicating the estimate that you're hoping to obtain by the end of the year. How many of what you'll be able to do. That's exactly where we'll go in that column. The next form that we'll be looking at is the 432D, and that is your schedule of salary costs. If you are going to have salary individuals on your program grant, then you will have to provide their job title, the name of the person that's filling that position, and the type of services that they are rendering, and also their salary amount. Again, we are asking individuals that apply for the grant to make sure that they will use and make sure that they're not going to be too heavy in the salaried area so that the program gets the majority of the funding. Of course, if the person who's going to be salaried is also going to be a person that's going to be out in the field conducting the work, then that's pretty much understandable. So that's how we would look at that. The next form, if you have a consultant. Now, consultant, you can have someone who is working along with you, but they're going to be required to do something that you may not be skilled to do. That's where you can hire a consultant to take on that particular role. And if you do that, you would identify the name of the consultant, their professional area, the highest degree that they had, their hourly rate, and then the total hours that you're gonna have them appearing on the grant. Now, knowing that this information, you have probably identified that how many hours that you would need that consultant for, of course, for a particular part of the program, not for the entire program. You may hire them for maybe for an activity that would take place in December or June or something of that nature. So they're not carried through the entire grant, but only for a specific period. That's why we identified exactly what their hourly rate is and also how many hours they're going to be allocated to the grant. This allows us to get a feel for exactly how you will be having the staff or the resources in order to carry out the program in which you are putting in place. Again, at the top of the form, we're asking you to provide us with the organization name, your award number if you have one, and also the fiscal year. The next form, if you're going to be required to purchase any equipment to support anything that you're doing. Of course, equipment is something that once you purchase it, it will still belong to the state of Maryland, and I have to make sure that that's known. So you can't go out and get a car. You have to make sure that stays within the scope of the business in which you're doing. With any equipment, you have to provide the type of equipment, exactly what it's going to be used for, whether it's replacement or something that you already have, or something that's new. The purchase of service is sort of used for if you require someone to provide service to your organization to take over a portion of the grant that you are not able to do so. And purchase of services is limited to individuals who get funded over $50,000 and above, so this would really not pertain to you if you are applying for $25,000. So this form is something that we pretty much skip. The next form that we'll be looking at is your anticipated sources for funding. Of course, the first line is the total dollar award that you're asking for from the state of Maryland. And if you get any other local government awards or any other awards or any other fees, that's also, you can also indicate that. And also if you have any in-kind contributions, which is the last portion of this particular field. And once again, the information that you put on these pages, they all must be in line with what you have recorded on that 432B, the budget form. Because if one figure is incorrect, the whole entire form package will be returned. So that's why we have to make sure that you're aware of exactly what goes on each of the lines and how they are, how you have to make sure that before you turn in your forms that you have reviewed them and that they are correct. Your budget justification. Now, the narrative part of your budget justification, you have to pay very close attention to why you're justifying the dollar amount that you're putting in your budget to either for consulting costs or food or for any other things, because what we tend to do is that once we look to see exactly the activities that you're doing, we will look to see if the budget is in alignment with the activities. That's how we can tell, because the budget justification will also support whatever you have put in for your activities and will also add up back to your 432B. That's all I have.
So that's it for the
Fiscal, yeah.
the fiscal, yeah. So we'll now go into the questions and answer session. Thank you, Diane. Thank you, team.
Thank you, Namisa. Thank you,
Thank
Dr.
you.
Mann.
Thank you.
Okay, so
So we are going through the questions now. A lot of you sent in questions. And I think the last one I saw on the screen was about the Gantt chart. That somebody said you cannot access the Gantt chart on the screen. On the website?
on the website.
Okay, we do have our health planner, and she is actually going to look into it. She is responsible for uploading all the attachments and all the forms that we have on the website. You know, she is actually our IT guru, and she had uploaded everything. She is going to go back and find out what the glitch is, and she will correct it. And I've noted that, and I'll actually will actually send an email or a note on the website saying that that has been corrected, and we'll do that as soon as possible. What are the questions?
Okay, so the first question was that, and I think it had been addressed, that will the slides be sent out and when?
Okay, we will actually upload the slides by Tuesday. Yeah, I wanted to say Monday, but by Tuesday latest, because what we have to do, we have the IT department here at the Maryland Department of Health. We have our own IT folks, and I'm going to send the request to them as soon as we complete the session, and to request the recording as soon as possible. And I'm going to impress on them that it is imperative we actually upload the recording and the slides as soon as possible, so you all can access that in time for you to start writing your proposals. Make sense? Yeah, next question. Dr. Alongi is actually helping me. Next question, Dr. Alongi.
So the next question was, somebody had put up that you can only apply for one disease focus area. One focus area could have an impact on several areas mentioned. So they wanted to know how that can be done.
Dr. Mann?
So
Our epidemiologist will answer that.
So ultimately, you're designing a program that's going to set as its primary outcome measures something that's in one of the 6 focus areas. So you might be saying our primary outcome objective is to measure an improvement in obesity. Now, when you improve obesity, that's good for heart disease, it's good for stroke, it's good for cancer, it's good for arthritis, it's good for diabetes. So yes, when you make a difference in diabetes, it will do benefits for multiple areas, but your program is designed around and is primarily tracking obesity. Now, if you decide that you're going to be working in diabetes, and maybe one thing you might do is say, we'd like to deliver the diabetes prevention program, so we're going to identify people with prediabetes, we're going to deliver the program, we're going to measure whether or not we've actually reduced their risk factors for diabetes with the DPP. Have we improved their physical activity? Have they improved their diet? Is their BMI improving? And if their doctor is tracking their prediabetes by measuring glucose and A1Cs, maybe those are actually getting better, and you might be able to ask them about that. Clearly, to get to the outcome of diabetes, you're going to be working on diet, you're going to be working on physical activity, you're going to be working on obesity, but the program is built around, at the end of the day, how did we do on moving a metric on diabetes and the related risk factors. Whereas, or for obesity, you're going to be focusing on obesity. If it's asthma, you're probably going to be looking at ED visits and hospitalizations for asthma. If you're talking about pregnancy outcomes, you might focus around infant mortality, but for a small project, it's probably easier to look at whether, in fact, the women you're tracking during their pregnancy had a full-term delivery, did they have a normal birth weight, did they get into early pregnancy. So one or more of those things is going to be your main metric of success, and there may be other metrics that feed into that, and there will probably be lots of other metrics that flow out of that that may be beyond your ability to measure. So yes, while a lot of these things are interrelated, you've got to pick one particular metric that's going to be the thing your program is designed around, and the thing that you're going to hang your success or lack of success in your evaluation piece around. So you've got to have that one primary outcome metric in one of those 6 focus areas.
And also, just in addition to what Dr. Mann has actually said, is that you would also have your performance measures developed around the one disease focus area. And like Dr. Mann said, you would have like physical activity, nutrition, all these activities is to actually help the person who is obese. So if you are targeting obesity, so you will actually have those. But your performance measures will be developed around those activities. And what we are going to do, just to probably put some of you, a lot of you at ease, a lot of people are good at developing proposals and actually developing their own performance measures. But what we will do, internally we will look at these performance measures and actually see how realistic they are and if they actually do align with your proposed program. So, and because those performance measures are going to go into the conditions of award document that we have here in the office that we'll be developing. So we will work on that. As soon as we see your proposal, we'll actually work with you. If you're awarded, we'll work with you on your performance measures. And thank God we have our FP guru here, so he will be working with us to develop those performance measures. And they will be very realistic.
So we'll take the next question, but just to mention, for those who are still on the webinar, you should be seeing a blank screen at this moment, and we're just attending to the questions. So the next question I think is similar to the last one, and it talks about regarding the expected focus slide, do all proposed projects need to include all of those foci? For example, do all projects need to include CHWs, visiting nurses, and or social workers?
Well, Dr. Mann will answer that, but let me just, before Dr. Mann answers, not necessarily. You would know when you develop your program if you're going to need a CHW in that program, and what would that CHW be doing exactly, to sort of attain the outcome that you are proposing in your program. The home visiting, it will also depend on your proposal. What are you proposing to do? And do you need a home visitor? Do you need a social worker to go out there and conduct home visiting once a week for, this parent who has this asthmatic child that they're constantly in the ER? Every time you turn around, this parent is in the ER. Why is the parent in the ER? What are the home conditions? Do you need a social worker? Do you need a health professional to go in there and look in there? So that we cannot decide for you because we really don't know, what you are going to propose to write about. But you have to choose one focal area, and you would know if you need all those, people to do the program, to actually implement the program. Dr. Mann, did you want to say something to that?
Yeah, I think it may be helpful if people have the RFA in front of them to look at page 11. And there we've got a listing of items A through D where we figure people will be doing one or more of certain activities, and those activities include health education, improving insurance enrollment, self-management support that might include, home visiting, community health workers, visiting nurses. Those are all potential strategies or mechanisms you might use to achieve the goal of your program. Mm-hmm. And so they either will or won't be in your program depending on whether they fit to the kind of program you're designing. So I think for that list, those aren't mandatory that everybody do all there. It's a list of things that might fit into the program focus area as you build the design of your program.
Yes, and also just understand the RFA is a guidance. It's to guide you to design your program. You're not going to need every strategy that is mentioned in the RFA, but you can actually choose something that will, sort of fit the program that you're going to be designing. And we also have a link for best practices programs. And Dr. Mann, in his presentation, actually stated that you can go back and look at those best practices. Those best practices you can replicate in your communities. It doesn't have to be exactly the same, but you can look at those best practices, something somebody has done, maybe in Worcester, in Massachusetts. You can look at that and say, wow, let me try this. Let me design a program like this, but it will be maybe slightly different because you have a different population. You may decide that you want to target the Hispanic population. You may decide that you actually want to target the immigrant population, you know, African Americans who are here. So you may have different target populations, but you at least will look at those best practices programs that we have put on that link for you to actually look at and get an idea of how to design your program.
Okay, thank you. So the next few questions I think I could answer with a yes or no because they're similar to what we already discussed. Next question says 5 bullet points on expected focus screen. Do we have to do all these or only those that have to do with the project? So no, you do not have to do everything, but just those that are related to the project as already discussed. Next question says, are the cover letter and executive summary included in the 10-page limit? The answer is yes.
No, it's not.
No, it's not.
No, it's not.
And I'm sorry, so the answer.
No, it's not. The cover letter is simple. The cover letter, like, you can have like maybe 2 paragraphs, very short sentences that you are interested, you are just writing to the program manager or to the director saying you are interested in the program. And then, of course, your executive summary. We told you already what should be included in your executive summary. Your capacity, your capability, how long you've been around, just selling yourself. So say, you know what, I am equipped, I'm ready for this program, I am going to be the best motor program, grantee that MHHD has ever had. So those are the sort of things, but it's different. The executive summary is different. The cover letter is different. The 10-page document is actually going to be concentrating on the design of your program. That's it.
Okay. Thank you. So the next question was about that you couldn't see the org chart, organizational chart, or the logic model. We'll make those available to you on the website. And please know that the organizational chart is just a template. You could edit it on your type of program. And the question.
And also, I'm sure a lot of you already have an org chart. So a lot of people know an org chart. But if you don't have an org chart, the org chart is, you're going to create an org chart based on your design, the design of your motor program. I think it's good that we emphasize that. It's going to be for the motor program. You have the director, you have the program manager, you have the CHWs, you have the home visitor, and the chain of command and who reports to who, and then how it all comes together to make your motor program a cohesive and strong one.
So thanks for your comments about the Gantt chart. It's been discussed, and we'll make every necessary correction. So the next question was regarding the jurisdiction. If our population of focus resides in a different jurisdiction, but they are active patients of our hospital, will this program still be acceptable? Regarding the jurisdiction, if our population of focus resides in a different jurisdiction, but they are active patients of our hospital, will this program still be acceptable?
No, that's no, you have to actually, I'm sure, I know where this question is coming from. There are people who live in Washington, D.C., and even in Charles County, who come to PG County to access services. No, you cannot. If you know that they live in Charles County, and they live in Washington, D.C., or they live in Montgomery County, but they are coming across to access services in Prince George's County, no, you have to take them out of the program. Concentrate on those that are in your jurisdiction, because at the end of the day, the data, if the data is affected positively, it should only be for that jurisdiction, because that's how the State of Maryland Department of Health is collecting data. When you start mixing the data, it becomes very confusing. So concentrate on only clients in your jurisdiction, please.
Thank you. The next question says, is the logic model based on organization goals on the specific area being addressed in MOTA?
Specific goals that you are going to develop in the MOTA program, not your organization. You are going to design a program for MOTA, for Minority Outreach and Technical Assistance. Maybe you are going to concentrate on cancer. Your goal, like when Dr. Mann was talking, I think it was Dr. Alongi, she showed you that work plan. You have an overarching goal. You know, at the end of 1 year, we would like to see that maybe 20 people in Kent County, you know, reduce their BMI by such and such and such, you know, percentage. So that is what you have to concentrate on. It's not the goals of your organization. It's the goals of the program. I hope that is clear. And please, if you don't understand, send me an email, and I will try to respond to your questions. And if it's something that is complicated, I will contact, you know, the team, our director, our epidemiologist. Thank God he's always in the office, so that we'll actually respond to your questions. We make sure that you write a good proposal. Next question.
Next question says, should we write out the work plan and then include most of the same content in a logic model? Would the logic model count as one page?
Yes, they're attachments, by the way. They are separate. These are separate attachments. So when you write your proposal, the body, that 10th page is the body of your proposal. You are sort of like narrating. You're going to tell us what you're going to do. The work plan is like guiding you on how you're going to go about implementing each activity of your program. So the logic model is different, and also the Gantt chart is different. The Gantt chart is almost like a timeline.
Thank you. So the next question, and it says, just want to make sure I heard correctly, all outcomes, short, mid, and long term, should be accomplished within 1 year in the logic model?
Right, because we're basically looking at a program that's going to have a 1-year duration. And by the time we get to the end of the year, we are looking for a measurable benefit to health status indicator in the people that you're dealing with. So whether it's their BMI, whether it's their nutritional pattern, blood pressure, whether it's ED visit rate, something like that, something we can measure that says this is has done better as a result of the program. That's ultimately what we want to get to. Now, in a sense, 1 year isn't very long term, but in the duration of the program, that's all the time you got, so that's basically the one-term piece. Before that, people need to make a behavioral change, and that's kind of the middle-term thing we expect to change. Before they make a behavior change, they have to get a change in knowledge, attitudes, and beliefs, and that's kind of the short-term piece. So I think converting the standard logic model format into this notion of short, middle, and long-term for a 1-year project kind of falls into that way of breaking it down.
Okay, thank you.
So there will be some programs you will have, you know, some activities that will last 3 months. And then you have some activities that will last for 6 months. And then you will have some activities that will last for a year. But you have to, you know, like when we're talking about the evaluation, some of those activities, you're going to be continuously evaluating them, which is the process evaluation. So you are going to be constantly evaluating them to make sure that you are on track in completing them at the end of the fiscal year, which Diane actually alluded to and stated that it will be by the end of June 30th of 2019.
So thank you. The next question says, to confirm, the work plan, logic model, and Gantt chart are to be included as attachments and are not included in the 10-page limit. Yes. The answer is yes.
Yes.
Next question says, what if the local health department does not focus on the area we apply to focus on? We can get a letter of support from them, but what would shared responsibility look like for that? The reason the program is needed is because it is not provided by the Department of Health, for example. So the question is, what if they do not focus on that? They would get a letter of support, but not saying that they were going to do something with them?
Yes, it's possible that, I mean, and this is why we are actually, if you look at MHHD specifications and requirements, we require you to really have a relationship with your health department. And this is where the health department will be really happy to have a motor grantee in their jurisdiction, because what they cannot do, they depend on the motor grantee to actually carry it out. So this is really sort of like a symbiotic relationship. You know, it's going to be, you are going to be together. You are going to have to go out there. If you have to go meet the health officer to sort of start that relationship, you need to start ASAP, because you are needed. People don't even know how important, you know, being a motor grantee in a jurisdiction is. Some jurisdictions, the local health departments have called MHHD to say, we need a motor grantee in our jurisdiction. So please make sure you have that relationship with your local health department, because they're going to need you, trust me. And if you design a good program, they are going to be happy that you are in that jurisdiction.
So in the interest of time, it's 4:28, and we still have a couple of questions. We're going to run through these questions. If you have further questions, you would need to reach out to Ms. Kramer. So the next question says, can an organization subcontract out to another research or evaluation organization for the evaluation portion of the project activities?
Well, I think that once you start trying to subcontract evaluation beyond, say, hiring one individual as a consultant, you're probably going to end up spending more on evaluation than any motor program could afford. Basically, we're not actually asking for anything complex in evaluation. We're basically asking to count stuff.
Yeah.
You know, collect how much of something's happened, count it up, and we basically see if did we do what we promised, and did this health indicator get better at the end of the program compared to what it was at the beginning of the program. So I think it's important not to overcomplicate the evaluation process, and I think grantees ought to expect to be able to do these fairly basic evaluation things within their own programs. If someone thinks they need to subcontract out evaluation, it might be worth just giving us a heads up as to what you think that would be, because you may already be overcomplicating the evaluation.
Yeah. And also, here's another thing. Fiscally, you cannot subcontract, and we have stated that. But you can have a consultant. You can pay somebody, you know, something to evaluate the program if you think you are struggling with the evaluation portion. And let me tell you something. You don't have to pay them to evaluate the program throughout the implementation phase. What you can do is probably when you're writing your proposal, have a consultant, somebody who is really good at evaluation, to help you put your evaluation strategies or tools in place. And so you can include that in the proposal. So that way, it's one-time done deal. You pay them, they've helped you with the proposal, and they are gone. What you need to just do is to have that staff in place that knows how to use the evaluation tools to evaluate the program. Again, if you have further questions, email me. We are here to assist you. We will not write the proposal for you, but we will help you. Will help guide you to write the proposal.
So the question about will be sent a link to access the recordings and slides, I think information about that will come at a later time. Next question says, can this funding be used to amplify an existing program that we have been running for a while that is within the scope of this RFA? For example, use the funding to expand the capacity and services to additional target populations, or to fund portions of the project that are currently unfunded?
No. That's a no. Here is why. Motor programs, the state is coming after us. Like the way we are talking about evaluation, we get audited. We want to know what MOTA is buying. That is why we are stressing the data collection. We want to know what MOTA is paying for out there. When we go to Annapolis and we are presenting, Dr. Mann is presenting data, we want to say, oh, in Prince George's County, our MOTA grantee X, Y, and Z actually sort of helped 20 women, 20 women with asthmatic children from actually visiting the ER, 10 times in a month. I mean, these are some of the things that we'll be reporting. So your organization gets credit, for actually collecting good data and implementing a good program. Dr. Mann, did you want to say something?
Yeah, the key thing is that we need to be able to figure out that there's an additional amount of reach that's attributable to MOTA, and there are specific outcomes that are attributable. So if someone has a program where they say, we've been running 10 cohorts of the diabetes prevention program with some other funding, and we would like to take the MOTA money and do 4 more cohorts. So you can say these 4 cohorts belong to MOTA, and these 10 cohorts belong to our other funder, and track it in parallel but separately, then I think kind of a thing would be okay, because then we've got our hands on exactly what MOTA's buying. But if we're putting the MOTA money into a giant melting pot and it all gets stirred up and we can't sort that out from the rest of it, then we have no way of saying MOTA actually bought X, and that's the thing we can't do.
So MOTA has to be, please write this down, MOTA. If you're going to apply for MOTA funds, it has to be a stand-alone program. You cannot mix it with any other program. You cannot do that.
Okay, thank you. The next question I think has been answered already. It says if an organization submits as part of a consortium with one county, can they submit a separate application to another county? We are located in both Prince George's and Montgomery County is the reason for the question.
No, it has to be separate applications. If your organization is located in Prince George's County and it has a satellite office or another office in Montgomery County, the one in Prince George's County submits a separate application. The one in Montgomery County submits a separate application. But you have to understand also that the jurisdiction, is different. The geographic and demographic makeup is very different. So you have to make sure that the applications and proposals are different.
Okay. Can funding be used to provide medications or equipment or for the target population? Can funding be used to provide medications or equipment or testing for the target population?
I guess the question is, could you use the money to pay for people's prescriptions? I guess that's kind of not what my first thought of a MOTA program would be. But I mean, I don't want to say there's no structure where that wouldn't fit.
Yeah.
But most of the time we're trying to make sure that we're bringing in a discrete set of people who the program is recruiting and working with. So if the program had
I guess, can I ask more directly, since I asked that question?
Yes.
So we are thinking of developing a lung cancer screening program, and the concern was if the population may be uninsured, and if we want to test them for the screening, and if they don't have any resources, can we use the funding for those type of patients?
No.
It will be limited, but can we use it?
No, you don't do that. You have to refer to the health department. You have to refer them to the health department. You have to design a program wherein you can have, let's say you can recruit clients educate them, teach them, or if you have a DPP program, talk about, educate them about their physical activity, nutrition, BMI, A1C3, A1C, but you have to make sure that you refer them and then conduct follow-up to make sure that they have received the needed services that you have documented during the implementation of your program.
Okay.
Does that make sense?
Yes.
Yes, because we are not giving out money. Okay, you know what? Send us an email. We need to really look into this. But send us an email telling us exactly what you're proposing or what you want to know.
Okay.
I think in general, the notion that MOTA funds could stretch to fill the gaps of uninsurance for people. I don't know that MOTA is funded enough for that to be.
No.
Because lung cancer screening is going to be CT scans. Those are going to be pretty expensive per person. I'm afraid if you spent the money that way, you'd end up
you end up
having a very small amount of reach left after doing that. So I think we'd be
You
more
probably
trying
have
to get people to get existing screening programs. Now, you might try to, you might, as part of a program like, we're going to work on getting people who are eligible for things through ACA or the Medicaid expansion to get enrolled in that and get their But to actually start just paying the bills for medical services.
That would be too costly.
Okay.
Costly program. So I think, and especially if you're going to be applying for up to $50,000, you want to spend $50,000 to get as many people screened as possible and then refer them, to the appropriate hospital for the appropriate services so that they are treated.
Okay.
Okay? Okay, great.
Thank you. So the next question, I'll take the next two together. It says, is this funding for new projects only? And the next one is, what is the number of cohorts expected? Is this funding for new projects only?
No.
What is the number of cohorts expected?
Okay, the first question, this funding is not just for new programs or new organizations. It's also, if you have been a MOTA grantee with MHHD, you're welcome to apply. But one thing I want everybody to know, this is a competitive. It's a very competitive. We have, when we started, and I think most people, except for one or two that have dropped out, most people are still on this call. That tells you people are very much interested. So this is a competitive application, grant application, and we now have like 55 people on this call, on this webinar session. So I just want everybody to know that. If you were a former MOTA grantee with us, we don't just automatically say you are okay. We have to go through the review process. I want everybody to know that. And if you're new, you are interested, a lot of you have contacted me via email and phone calls, and I've said to you, yes, you can apply as long as you are in the state of Maryland. And you are a 501c3 organization, you can apply.
Okay, in line with that, the next question was, how many grants are being awarded?
No, that cohort. How many cohorts is needed?
Okay. What is the number of cohorts expected?
And so I think the answer there is that really depends on the kind of program that you're doing. So it might be that everything you're doing, that you basically got people who you identify, you bring them into the program, and they all kind of are a single operational group. On the other hand, for things that are much more specifically structured, and again, a good example is diabetes prevention program, a 16-week program, so there's a week 1, there's a week 2. So one group of people are going to start week 1 in September, another group of people are starting week 1 in October. They're clearly two separate cohorts because they're on two separate schedules. So and depending on how much the funding you have is going to stretch and how much it costs you to run your cohort for a certain number of people, you might have one cohort of 20, you might have two cohorts of 10, you might have 4 cohorts of 5, and different programs will have different kinds of numbers. And the more the more touches there are within a cohort, the smaller the number of people you're going to have for the money that you have. So a small number of touches will probably touch more people. A large number of touches per person is inevitably going to have to touch fewer people. But often that gives you the best outcome.
Yeah.
So you're going to have to figure out how the kind of design you're coming up with and the outcome you're looking at and the kind of evidence-based programs you may be using as guides, how that turns into, is this all a single cohort? Is it people on separate schedules? So there's more than one cohort? Design work for the proposal has to be.
Yeah. And let's say you're getting $25,000. You applied for $25,000 based on the jurisdiction that you live in and you reside in and the population. You may decide that you just want to do 2 cohorts with $25,000. You decide you want to do 1 cohort, but also that depends on your recruitment ability. How many people did you recruit in the program, and are they willing to stay with the program, the entire course of the program, up until June 30th, and until you see changes in them? So these are questions that you have to ask yourself. That's why we are saying just focus on 1 disease area. Don't take 2, 3, or anything. Don't get yourself all confused. Write a very good proposal.
Thank you. Next question, how many grants are being awarded?
We can award up to 1 for each jurisdiction, but it also depends on the types of applications that we get. And by the way, also, just so you know, we do not review the applications internally. We send the applications out. We are also recruiting, engaging our external reviewers. We send them out to external reviewers. They review them. When they come back, we then conduct an internal review before we even award the grants. So it's like, this is state dollars. We are sorry, but it goes through all this process. So in the end, for example, last year we had 28 applications. We ended up funding 16. So I just wanted to throw that in there so you are aware.
Okay, thank you. Can one organization apply for 2 different projects or only 1 project?
No, please concentrate on one program. Choose 1 disease-focused area and apply for, and actually design your program around that disease-focused area so you can actually make a difference in the lives of your target population in that jurisdiction or in your community.
Okay.
Is that it?
No. Last year, what areas were awarded, and I think it's just similar to the areas being awarded this year.
Yeah, it's similar to the areas being awarded, but last year we also had tobacco. Tobacco was in there. We actually funded somebody who was who designed a program around smoking cessation.
Thank you. Our next question, our organization is located in PG County, but we are expanding to Charles County. Can we complete a proposal focused on Charles County?
Yes.
They are expanding.
Oh, that is absolutely yes.
As long as you have a business address in Charles County.
Yes. Thank you, Dr. Mann, for...
So if you're expanding your facilities into Charles County, then yes. If you're only expanding your interest and activity into Charles County, then no.
If you're going to, you have a physical office, located in Charles County, and you're going to, have an office there, you're going to design a program targeting the population in Charles County, yes, please apply.
Okay, so the next question said, okay, we're still in line. It was the same person that asked that if focused on the southern area, does the organization have to focus on Calvert, Charles, and St. Mary's County, or can we just focus on Charles?
No, you just focus on Charles. Please don't.
In fact, applications need to be jurisdiction specific.
Yes.
Because in a sense, what we're doing is we're saying we're providing money to a jurisdiction for somebody who is inside that jurisdiction, and therefore we're developing capacity within that jurisdiction, to benefit the people who live in that jurisdiction. So the funds, the applicant, and the target population are all for one application within one jurisdiction.
Yes. So no, don't go to Calvert, don't do, what's the other one, St. Mary's, just concentrate on the people that live in Charles County.
Okay. What about innovation? Incorporating ideas that were not mentioned to accomplish the objectives.
Oh, of course. We want to see, cutting edge strategies in actually program development and implementation. We will certainly be happy to see that in the proposals.
So the next questions have been answered. How many programs will be supported in all? Can we focus on two jurisdictions? And we've said no. You can only focus on one. Is nanisa.k.kramer1@maryland.gov email to use for additional questions? And the answer is yes.
Yes.
That's the final question.
Okay. Thank you very much. This concludes the webinar, the pre-application webinar session. So if you have any questions, please email me. And if I have any issues or I'm sort of stuck, I will talk to our able EP, Dr. Mann, epidemiologist, Dr. Mann. And then, of course, if you have any fiscal issues, if you email me, since I'm the contact person, of course, I'm going straight to Diane Walker, and we'll answer we'll make sure that we answer all your questions. Thank you so much, and this concludes this session. Bye, and good luck to every one of you, and we look forward to reading your proposals. Hopefully, they will be great, so that we can decrease health disparities in the state of Maryland. Thank you so much.